Hi physiotherapists, this video is just for you. In this video, I'm going to explain how to approach a writing task, how to use your 5 minutes reading time effectively, how to demonstrate the 6 assessment criteria in your writing, how to use the sample answer provided, and how to learn from completed writing tasks. So, let's get started. The physiotherapy writing test includes 3 possible types of letter: referral, discharge, and transfer. The reader of your letter could be to a number of different healthcare professionals. For example, physio to physio, physio to doctor, physio to specialist, etc. Until you turn over the test booklet at the start of the reading time, you don't know which scenario it's going to be. The most important point is to be prepared to be flexible to meet any one of these letters and readers. Every patient is different. Their social background, their medical history, their current situation, these will all be different. Just like you wouldn't speak to each patient you meet during your working day using the same language and expressions, you need to be ready to use language and paragraph structure to make your letter personalised to this patient and this situation. Only then will you be demonstrating to the assessors that you have the English required to score a B grade or higher. Turning over the test booklet, there are 3 things you want to check as a priority. Although you cannot highlight or make any marks on your test booklet in the reading time, I'm going to highlight these 3 things so that you can clearly see what my eyes are looking at and can follow the approach yourself. The first 2 pieces of information are provided at the end of the case notes, so go straight there. Who are you writing to and what is their job role? In this situation, we can see that we're writing to Dr. Delbridge, a general practitioner at Underhill Medical Centre. What are you writing to Dr. Delbridge about? We can see that we are outlining the patient's presenting complaint, relevant medical history and your assessment, as well as requesting further investigations. Back at the start of the case notes, you will find the 3rd piece of information. What is your role in the patient's care? You are a physiotherapist at a local clinic, and a new patient, Mrs. Melanie Wright, has come to speak to you about pain in her left knee. Before I start reading the case notes from the beginning, I want to make sure I have completely understood the reason for writing the letter. So another good place to check for any detail about this is the last information in the case notes. I notice here the NB line, which means important information. And it tells me that the patient has no doctor in the town and that she has requested a recommendation. With this in mind, and remembering the specific reasons for writing this letter, to refer Mrs. Wright to a new doctor for further investigations, I can start reading the case notes line by line, deciding whether each one is relevant to the reader or not. To help me make the decision, I will ask myself 2 questions each time. Is this case note relevant to the current situation? And will this case note affect how the reader continues to care for the patient? If the answer to both questions is no, I can omit this information. But if the answer to either question is yes, I will include this information somewhere in the letter. In the reading time, you have to make mental notes as you read for your understanding. I'm going to highlight the notes which I pick out to be relevant so you can see what I'm doing. The patient's name and date of birth are standard to be included as part of the RE line. And I'm going to need today's date, which I'll include in my letter under the address. From the social background, the fact that she is a keen walker is important, but not so much the duration, because that is what is implied by the word keen. Her medical history of knee surgery is significant, as is her recent increase in gym use, which could be a cause for the current condition. Then we come to the assessment section, much of which will read as standard to you as physiotherapists. I skim through this, picking out relevant details that are related to the knee problem. So from the presenting problem, I notice that she's had intermittent knee pain and some swelling as well as tightness. but I omit the occasional lower back pain because this is not related. From the current background, I notice how the current pain started. So something happened while the patient was walking 2 weeks ago, and since then she has taken some measures to improve the situation, taking Panadol and resting. But there hasn't been any improvement and she's still finding some locking and unable to straighten. From the next section, I notice what the pain is like. So it's unpredictable and swells by the end of the day. And from the 24-hour behaviour, I notice that it's more difficult at night, that it's better in the morning, and again by afternoon is more swollen. The next sections are not particularly relevant to the current condition, so I move on to the next page and continue looking for more details that would be useful to the reader. I notice from the objective exam that the patient is limping and unable to straighten the knee, that ascending stairs are difficult and slow, that she lacks full extension and flexion, increased pain on passive extension, and tightness in her hamstrings. The joint integrity tests are not relevant because they are all normal, but the next line about palpation is, as well as my diagnosis, that the patient has further damage to her left knee. Finally, from the action section, I focus on the 2 advice notes which will be relevant to the GP. That she is advised to have further investigations and to reduce weight-bearing activity in the meantime. Having reached the end of the case notes and talking myself through the situation, I now feel I have a good understanding of Mrs. Wright's history, but also how I'm going to structure my letter. If I still have time left out of the 5 minutes reading time, I would read through everything again carefully, reminding myself of the decisions I just made. Once the writing time starts, I would now underline those notes which I highlighted for you, so I have a clear record of the information I want to include in my letter. I would also turn to the blank page on the back of the answer booklet and make a very rough plan of my letter structure. A thematic approach to pick up on the main issues for the reader seems best. In the introduction, I will introduce the patient and the reason for the referral. In the middle paragraphs, I will provide details of the presenting complaint and report the results of the examination. In the final paragraph, I will cover my advice to the patient. I'm now ready to start writing. I have a clear plan in my mind, and it should be easy to record all the information in the 35 minutes I will have left and still keep some of this time to check my work at the end. I'm not going to write the whole letter now, but just to point out a few things. Opening my answer booklet, I'm going to start with the reader's name and the address, which I can copy directly from the writing task. Underneath this, I will add the date, which is today in the case note, the 30th of August 2019. Next comes my greeting, Dear Dr. Delbridge, followed by the RE line. But remember that the order of the greeting and the RE line can be reversed if you prefer. So this RE line is Mrs. Melanie Wright, DOB 080673. Then will come the body of my letter, the paragraphs. The introduction introducing the reason for writing, and the presenting complaint paragraph, the examination paragraph, and finally the advice paragraph. Underneath all of this, I will add my ending, yours sincerely, and finally my job title, Physiotherapist. As you write the paragraphs, think about how you will summarize the information. The aim is not to write one case note per sentence. For example, the details from the examination can be combined into 1 or 2 sentences. Once you have finished writing, use any time you have left to check your letter against the case notes you underlined to make sure you have included everything you identified was relevant. Read it as the doctor. By the end of the letter, do you understand Mrs. Wright's situation and what you need to do for her? If necessary, make edits to your letter if anything needs clarifying or adding. Now you have your completed letter, it's time to look at the sample answer. There are some important things to remember with sample letters for official OET tasks. They have been written and checked by both language experts and a physiotherapy subject matter expert to make sure they are accurate medically and linguistically. That doesn't mean they are perfect or seen as the only way to write a letter about these case notes. You might have used slightly different language or structure to your letter. Provided you have communicated the situation as per the task clearly to the reader, this will not be a problem. When reading the sample answer afterwards, notice the similarities and differences. If there are any differences, rather than seeing it as something that has to be corrected in your letter, think about why it is different. Why do you think the writer used this word or phrase? Is it more formal? Does it allow them to summarize some detail more effectively? Why do you think they structured their letter like this? Is there any difference in clarity between your version and their version? I want to finish off by giving you a few tips about how you can get the most out of this set of case notes after you've written the letter. Don't just discard this task and letter and move straight on to another task. Take time after each practice letter to learn from it and avoid making the same mistakes next time. Here are 5 things you can do to get the most value out of each practice task you complete. Assess your writing and the sample answer against the assessment criteria. The criteria are free to download from the OET website and contain both a description of the 6 criteria you are assessed on, as well as the evidence of what the assessors are looking for to be able to score you at the different levels. Take each criterion in turn, read the evidence statement for each level, and critically decide which statement is the best match for your writing. Type your letter into a document and check your language and grammar by using free tools such as Grammarly or spell checker grammar functions built into your word processing software. Notice the mistakes that are picked up and use them to create your own checklist of common errors to learn from. Rewrite your letter so you have a perfect copy to refer to as you revise. If you keep looking at your original letter with the mistakes in it, you are training your brain to remember the mistakes. Having a perfect copy to revise from will help improve the accuracy of your writing. Use the case notes as the basis for a speaking role play. Imagine you are having a conversation with Mrs. Wright in August. Ask a friend or colleague to play Mrs. Wright's role while you find out more details about her knee pain and make recommendations for treatment. Search the internet for podcasts on medial meniscus damage or medical journal articles covering recent developments in the treatment of the condition to practice your skills for the reading and listening parts of the test. With the right approach, the writing test is something everyone can do well. For more videos and test strategies, follow our social media channels on Facebook, YouTube and Instagram @official OET and search the OET blog available on our website.